Hi everyone, this is Dr. Ali Gosnell from Reshape Physical Therapy here in Winchester, Virginia. This week we've been discussing hypermobility. And on Monday we put out a video talking about what hypermobility is and some signs and symptoms that people experience who are hypermobile. Today we're going to talk about what causes some of those signs and symptoms and whether or not stretching is beneficial for people who are hypermobile. So, one thing or a few things that we hear people say when they come in for physical therapy who are hypermobile is we often hear them say, I feel stiff, I feel tight, I feel like I just need a really good stretch or something to release those muscles, or I feel like my joint just needs to pop. And what's happening in those individuals is that their muscles are trying to compensate for those ligaments that aren't supporting that joint. So let's dive a little deeper. You have your joint, bone, bone. You have your ligaments that connect your bone to make that joint. Now, the job of that ligament is to keep that joint nice and stable. So when your joint goes a little further than your body wants it to, those ligaments sense that and say, nope, come back here, stay stable. Now, what happens in people who are hypermobile is that that ligament is either like an overstretched rubber band or it's like very elastic. And so in those people, their joint starts to go in that increased movement and their ligament isn't giving the information back that says, no, come back and be stable. So the thing that often picks up that slack are the muscles surrounding that joint. And the muscles surrounding that joint then contract and try to make it really nice and stable. Well, the primary purpose of muscles isn't usually for it to stay stable. Now there are a few muscles that is their job, but for the majority, their job is to move that limb that's attached to it or those bones, and it's not to keep that joint stability. So then those muscles, because it's feeling unstable, try to stabilize that joint. Well, that means that they're taking on a second job. So instead of only doing their primary job, they're now taking on a second job. And that second job puts a lot more work on those muscles, meaning that they have to be stronger than the average person to keep those joints nice and stable. So because of that second job, that increased load of work, those muscles stay more in a contracted position and can get what's called a trigger point or a knot. And that causes those muscles to be in a more tight, less lengthened position. So those people usually feel that tightness and that stiffness because those muscles are staying really contracted. So what does that mean for people? Well, their muscles aren't able to lengthen like everybody else's because they're having to work. So the thing that we find for people who are hypermobile, that are really stiff, that really feel like they just need that big stretch, they just need to pop, is that they don't benefit from what's called static stretching, meaning that you hold that stretch and you just hold and hold and hold that stretch for as long as you can. They don't benefit from that. What we find these people benefit from the most is either what's called dynamic stretching, meaning that you move to that end range and then you come out of it and you don't stay there for very long. And they benefit from strengthening so that they can actually get strong enough to carry on that second job instead of being weak and not being able to do the two. So for people who are hypermobile and you feel like you really need to stretch, you can do stretching, just don't hold it for a long time. Move in and out of the movement. Try repeating that, not holding it. Try doing it really nice and easy for about 10 to 15 times. Usually that'll help you feel like it loosens up some. It may not all the way, but hopefully it helps a little bit. You can also massage. That can also help with those symptoms of feeling like it's staying contracted. Then the thing that you have to add on top, strengthen. Strengthen, strengthen, strengthen. And if you don't know how to strengthen, we're the perfect experts. Come see a physical therapist. Come see the people who know how to help you strengthen, help you get the right things working for you so that you can feel like your joints are nice and stable and you're not getting that tightness and stiffness all the time. So, if you're hypermobile, dynamic stretching, no static stretching, self-massage, and then get some strengthening in. All right, if you guys have any questions, shoot us a message below. Have a great day.